Hi, I'm Dr. Nikhil Gupta. I'm an endocrinologist with the CanMed Multi-Specialty and Weight Management Clinics in Toronto, Canada. Today we are going to talk about the proper administration of insulin injection. So I'm going to start with the supplies that we need to administer an insulin injection. So we need a hand sanitizer, or we wash our hands before we start to prepare our insulin injection. We need the insulin injection pen, we need the insulin pen needle, and we need an alcohol swab before we start. So the first step is, if you have a cloudy insulin, this one is a clear insulin. However, if you have a cloudy insulin, you roll it a few times to mix the insulin. If it is clear, you do not need to roll it. The next step is to use an alcohol swab to clean the tip of the insulin pen before the needle is placed. So then what we do is we remove the plastic covering behind the needle, and we screw the needle on to the pen. And we remove the big cap, we save it because we will need it later to remove the insulin needle. And we remove the small cap and we throw it away. Now we see that the needle is ready for insulin injection. The first thing that we need to do is to dial the dose to 2 units and push the dose to make sure that the needle is working by seeing a few drops on the needle. After that, we dial the actual dose. Let us say it is 10 units, and we see the dose in this window, and that is how our dose is ready for injection. Now we have to prepare the injection site and expose the injection site, which is usually on the abdomen. And what we do is we place at least 2 finger breadth distance between the belly button and the administration of the insulin injection. So I'm going to go ahead and inject the insulin in this sample pillow to demonstrate. And the other thing to mention is that there is no need to pinch before injecting. So we can go straight in with the smaller needles, which are usually 4 millimeter in size these days. So now I'm going to go in and deliver this sample injection all the way in, and then I will push the injector all the way down, and after I have pushed it all the way down, I will hold it for 10 seconds. So I'm going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then remove it. Now after removing it from the injection site, we have to remove the needle. We cannot leave the needle on the pen when we store the pen. So what I'm going to do is use the big cap and place it on the needle and rotate it counterclockwise. And what happens is the needle comes through in the cap. So the cap and the needle goes directly into the sharps container, which you can get from your pharmacy. After that, we close the cap of the pen and we store it at room temperature for about 4 to 8 weeks, depending on the type of insulin pen. In a nutshell, that is how we administer properly an insulin injection. Thank you for watching.